Hi everyone, welcome to our smoking cessation project. These are the team members. Some interesting stats here. Feel free to pause the video and look at them. Our goal is to offer ideas for clinicians who may be journeying with someone struggling with tobacco use or dependence. The first thing you want to do as a clinician is to assess the level of tobacco use and dependence. You want to identify what type of tobacco are they using, what's the quantity, what's the duration. You can opt to use some of the assessment tools, but the main idea here is they have the dependence, the greater difficulty of quitting. This implies that you may need to use a combination of methods. You also want to review their past quit attempts, methods they use, the duration, and what are some of the triggers for relapse. Assess the reasons for failure, whether it was withdrawal symptoms, social stressors, insufficient support, or just low motivation. As a clinician, you also want to assess their motivation and readiness to quit or change or modify their use. That is to determine their, the stage of change, and hopefully use MI to explore any ambivalence or evoke, change talk. You always remember that the client's own reasons for quitting are more predictive of success than any external pressure. You could use the MI ruler, for example, on a scale of 1 to 10, how concerned are you about your use? 1 being least concerned and 10 being most concerned. Let's say the client picks 6. You could ask them, tell me more about what puts you at 6. Or maybe you could find out why a 6 and not a 3. The main idea here is to try and evoke change talk. You always remember to tailor your approach based on the client's readiness to quit. If the client is not ready to quit, then you could use the MI techniques to deal with ambivalence and resistance. The goal here is to increase motivation and awareness, always remembering to respect the client's autonomy and avoiding any form of confrontation, using more of reflective listening. If the client is ready to quit, then the goal here is to develop a concrete plan and come up with behavior changes and probably pharmacological support that can assist the client. Our team looked at various evidence-based approaches that could be used with the client. I'm going to just to deal with the first one, which is CBT. CBT is very, very helpful in helping the client deal with the triggers and negative thought patterns and replace this with positive thinking and more healthier behaviors, including exercises and relaxation and even other oral substitutes. CBT is also very, very helpful in problem solving skills, especially in high risk situations.
Another important area to examine is whether behavior activation in conjunction with CBT increases abstinence rates from smoking. This randomized controlled trial compared a standard CBT group with a CBT plus behavior activation group. Some of the behavior activation techniques included identification of problem behaviors, self reporting of pleasant daily activities, and scheduling pleasant non smoking activities. At the conclusion of this study, it was found that the supplemental behavior activation did increase abstinence rates by 16% after 3 months. While the abstinence rates did level off in the long term, this behavioral activation technique could provide a valuable springboard for clients to make long term progress in their smoking cessation journey.
Now we are going to introduce acceptance and commitment therapy, or ACT, as an alternative treatment for smoking cessation, especially in group programs. ACT is similar to CBT, focused on thoughts and behaviors, but the key difference is that ACT teaches people to accept those thoughts and cravings without needing to fight or control them. The ACT group program for smoking cessation is designed as a step-by-step process that helps clients quit in a mindful way. In the beginning, Session 1 helps clients clarify what truly matters to them. Session 2 builds awareness and acceptance, teaching clients to notice triggers and cravings without reacting automatically. In Session 3, the "I am having a thought" that exercise helps them to see thoughts as just thoughts, reducing their power. Session 4 introduced cognitive diffusion through the exercise such as I am having a thought that I need a smoke instead of I need a smoke. Finally, in session 5, clients write a letter to their future self, reinforcing their commitment to long-term. Together, these sessions guide smokers to act in line with their value, not their cravings, and build long-lasting motivation to stay smoke-free.
So, another way we can support clients during a quit attempt is by helping them understand how behavioral strategies and pharmacotherapy can work together. Many clients are trying to navigate both the biological withdrawal and the behavioral routines that keep smoking in place. And this management can look difficult. When we provide psychoeducation about combining these approaches, clients often share that the process suddenly feels more manageable. Medications lower the withdrawal intensity, which gives them more bandwidth for emotional regulation, coping, and actually using the skills we introduce in therapy. Building on that, the evidence behind combined approaches is surprisingly strong. Meta analysis show that Varenicline increases the success rate by 2.5 to 3 times, and both bupropion and combination NRT nearly doubles those rates as well. When clients hear these numbers in a supportive and non addictive manner, they're better able to make informed decisions about whether medication feels aligned with their goals or not. The mechanism here is simple. When the biological drive decreases, clients can meaningfully engage with the behavioral strategies we are offering. When clients choose to use medication, we often see fewer withdrawal driven setbacks, which gives them more capacity for the behavioral work. And that's when the trigger mapping, coping plans, behavioral activation, and values work really start to take hold. And we always remember medication regulates the body, while therapy reshapes the behavior. And these two things work in tandem to support the lasting change. And from a practical perspective, our role is really about providing clear, compassionate psychoeducation so clients can choose what best fits their values and readiness. Many find it empowering to learn about options, whether that's a patch paired with a short acting NRT, varenicline for higher dependence, or bupropion when mood is part of the picture. When clients choose to integrate medication with the behavioral work that we are doing, even brief therapeutic support becomes more effective. And this can be especially meaningful for clients with limited access to long term care.
Emotional and motivational interventions use strong personal emotions to inspire lasting behavior change. One effective approach is showing clients vivid, personalized scenarios that help them clearly see the real health consequences of smoking or vaping and how those consequences impact the people they care about. When clients connect the behavior to something deeply meaningful, like their health, their future, or their family, it creates a powerful shift in motivation. This kind of emotional insight can spark commitment, increase readiness to quit, and support long term change. Another powerful tool for helping people quit is digital and online intervention. These programs use goal setting, self monitoring, and social support to keep people engaged throughout the quitting process. Because they're interactive and personalized, offering reminders, progress tracking, and even community forums, they tend to produce better results than static information alone. And the best part is, they're accessible to most people, allowing support and guidance to be available anytime, right from a phone or computer. Even with strong emotional motivation and various behavior support, quitting is still a process, and most people experience setbacks. Relapse is a normal part of learning how to live without nicotine, and almost everyone experiences it at some point. What really matters is building the tools that help people stay quit over time. People are much more successful when they have strong social support, when they replace old smoking or vaping habits with new healthy routines, and when they celebrate small milestones along the way. These steps help rebuild confidence, and over time, they make staying smoke free more sustainable.
As mentioned in many previous slides, it is important for providers to let patients know that quitting does not need to be a solo effort and is often better sustained with support. It is important to impart on the patient that combining counseling, be it via individual or group modalities, can be more efficacious than just medication by up to 50 or even 100%. It is also important to imply that there is no shame or the patient is not any lesser for utilizing additional resources. It is important for the provider to be aware of all the different types of avenues of support, as well as the nuances of medications and how they are available to the patient. For example, in the list on this slide, nicotine replacement therapies like lozenges, patches, and gums are available over the counter, but Wellbutrin and Chantix require a prescription. It may behoove the provider to know a few psychiatrists capable of prescribing such medications. The provider should be well versed in the additional support groups available to their patient. The California Department of Public Health website, for example, is a great starting point for a patient. Most of the resources provided on this list provide both online or in person modalities in some form of psychoeducation. If the patient is familiar with and prefers a 12-step program, Nicotine Anonymous would be a great starting point. Kick It California provides a personal quit coach, which is akin to a personal trainer that could help bolster a sense of commitment and accountability for the patient. On behalf of our group, thank you for taking the time to look through this presentation. We hope it provides a valuable resource for you as a provider to help make sure your patients are well equipped to begin their journey in smoking cessation. Thank you again.